we'll be talking about some changes at the federal level today. There's been lots and lots in the news about that, and I'm not promising that we'll get it all figured out today, but we want to give you some tools that you can use if you don't already have this information to help make a lot of this stuff maybe make more sense. Because there's so, at least for me, there's so much information coming out, it's kind of hard to keep up with what's what. So, and then also to talk, and we have not necessarily in this venue because it's happened since the last time we all met in this venue, but in other arenas, we've talked some about this, that the Secretary of Health and Human Services, Robert F. Kennedy, did a press conference, I think it was last week. And he had remarks on autism that a lot of people had different kinds of reactions to, and just talking about as we support families or as we want to share our feedback with policymakers, some things to keep in mind and ways to do that effectively, and then to look at, are there ways to share feedback with him and his office specifically. So those are the things that we were going to touch on today, but we always start with, did anybody come here thinking, ooh, what I really want to talk about is this, either at the state level or at the federal level or your local level, related to policy? And sometimes people bring up something that's not related to policy, but was there anything y'all wanted to make sure that we talked about today? Okay. Well, you know me, I'll just start lecturing about all this boring policy stuff, but try to make it make sense. Okay. Probably everybody here has heard or maybe works for a place where some money that people thought was going to be used in a certain way is now no longer there. Has anybody had that experience, either heard about it or had it happen where you're working? Right. Families as Allies, we had a small amount that we thought we were going to get one amount, but we got less. So we've had a little bit of that. And then some places, like you'll hear all the money that they thought they had went away, which is kind of scary, or everything they had for a certain program. Okay. And there's a couple of ways that has happened. And one way is, and we may have talked about this in this group before, is that during COVID, there was extra money allocated for certain things, like to help children as they return to school, to help the school buildings so children could come back and be safe. And the way there were different pots of money that were allocated, and the dates that that money ended on different dates. So some of the recent money that was clawed back that you might have heard about in the state, that mostly affected programs through the Department of Health and through the Department of Mental Health. That was money that was allocated for extra support for people related to COVID. And it was originally slated to last, I think, through 2006. And that was done through, and this will make more sense in a little bit, through a presidential executive order. And it wasn't allocated through Congress. So that meant a president had ordered it. So a president could then order, we're going to take that money back because we, that think that it can be better used another way or to pay down the debt. So that's what happened with that money. That's very simplified, but that went through, it was one president's decision to allocate it through an executive order. I think I've got that right. And then it was through that line that it was pulled back. So that was kind of special circumstances. So we're going to look at how do things happen at the federal level. And the federal level means, there's a state level, what happens in Mississippi, and the federal level means this is how stuff gets decided in the United States. I get policies and other stuff. Okay. Everybody with me? Okay. All right, this is going to be like, how many of y'all had to take civics? I'm old, so I took civics. I don't think they teach it anymore. How many of y'all have been to a civics class?
I did.
Okay. So all the old people are admitting. I saw Henry raise his hand. You don't have to mess with you, Nikki. Okay. So this is going to be a lesson kind of in how the government works. All right. I'm going to start sharing and we'll see if I can pull up the right thing at the right time. I'm just going to share my screen. We'll see what happens with me sharing my screen. Okay. All right. We're going to look at some different documents. And this first one, and I know this is tiny, but I couldn't find another one. This is just how things are laid out at the federal level of the United States. So this is how our government's laid out. And you can see there's a bunch of stuff on this chart. I don't know if I can make this bigger. But we're just going to look at the highlights. Okay, so this is the government of the United States. Oh, let's see if I can make it. Looky there, I can. All right. So our country, the United States of America, is ruled by the Constitution. And this is how the Constitution says things are going to be laid out. There's 3 branches. So let's start over here. The legislative branch. Does anybody know the main thing that branch does? What they do all day, every day, mostly when they're in session?
They're responsible for making laws.
Exactly. They make the laws. And that includes the laws about how money should be spent. And there's a whole deal, and we talk about that a lot during the legislative session here in Mississippi about all the things that happen for a bill to become a law. So it's much more complicated, and that's just something to think about on those bills involving money. Like, what's this budget going to look like? It's much more complicated for all that to go through the legislative branch because so many things have to happen, as opposed to some money that was done through an executive order of the president and then changed by the next president. It doesn't mean that the end result, might not be the same. Like there might be significant cuts with both, but it's more involved in the legislative branch. So they make the laws. Okay. Then there's the executive branch. Now, who's the main person in the executive branch? You can see it on here. I'm going to have to call on people. Okay, who's the chief executive of our country?
The president.
Exactly. So the president is over the executive branch, with the vice president under him, and then these offices that are under the president. And you can see there's these offices under the legislative branch. A lot of those, like I wouldn't, they're there, but that's not as far as the work we do. We don't have to remember all those offices, just that there's different offices there. Okay. And then the president has this cabinet with all these different agencies in the cabinet. And there's somebody over each of these agencies. I think they call them departments of the president's cabinet. So when you hear that the president's meeting with his cabinet, that means all these people are coming and saying, this is what my department's doing. This is what my department's working on. So the president is basically carrying out through the work of these agencies, the laws that the legislature makes and carrying out the work of these agencies. Now, all of these agencies, as far as I know, have been established in law, and it says this is basically what they're supposed to work on. Okay. All right, then we have one more branch, the judicial branch, which is the Supreme Court of the United States. What do they do?
They're responsible for interpreting the law and ensuring that it is applied fairly.
Exactly. So the president is the legislature makes the law, the executive branch, the president and his cabinet carry out the law. And then when there's disagreements, that goes through the judicial branch, and the Supreme Court rules on was that done in keeping with the law? And what does that law really mean? And that can mean, like, going forward, how is that law being interpreted? And there are a lot of disagreements in the country going on right now. I mean, that's no big secret. And I think particularly with immigration. So you can see that happening. That the Department of Justice, which is overseen by the Attorney General of the United States, they are looking a lot at immigration and deportations of people. And then you're seeing some of those deportations happen, and then that's the executive branch doing that, and then that going through the legal system. Now, it's typically starting lower than the Supreme Court, but I think some has gone all the way to the Supreme Court and saying, was that legal? Did that law get applied appropriately? So there's these three branches of government, and that's true at the federal level, and it's also true at the state level. So we talk about our legislature at the state level, same thing. Our governor is the executive branch. There's a Mississippi Supreme Court, but there's all these state courts underneath, and local courts that feed into that. So any questions just about this, the way this is laid out? There's not going to be a quiz on the layout. Okay. As far as the funding cuts that are most likely to affect the families that we work with, most of them are going to be related to the Department of Health and Human Services. So we're going to look at that department in more detail. And these departments are, some of them, and this is definitely true of Health and Human Services, are humongous. Like, they're their own thing, and they have a big old chart too. But that's where we're going to look and see some more there. Okay, so that's that. Now we're going to look and say, well, what exactly is in this Department of Health and Human Services? And there's a bunch of stuff. Okay. So this is an alphabetical order. Anybody heard of the Administration for Children and Families before? a lot of stuff related to child welfare tends to go through there. And then this one has been in the news a lot, the Administration for Community Living. And its purpose is to increase access to community support and resources for the unique needs of older Americans and people with disabilities. That agency has been greatly downsized, just some would say pretty much completely gutted, done away with within the last few weeks. The administration's response has been that a lot of those the functions that they believe were most important that the Administration for Community Living was administering will go through other agencies. So we'll look at that. And then some of these things we probably don't deal as much with, like these. I'm just going to scroll through so you can see there's a lot within this. And you can see that there's some agencies or some parts of this that are basically administrative functions. So like this one, departmental management, including human resource policy and departmental operations. And these assistant secretaries advise the person who's over it. And the Secretary for Health and Human Services, we mentioned him a few minutes ago, is Robert F. Kennedy. So these are all people who advise him. Okay, here's a biggie we've probably all heard of. The Centers for Disease Control and Prevention, that's the CDC, is under Health and Human Services. Now that's a really big agency, or one that we hear a lot about. So that whole agency is under Health and Human Services. And before I started really learning all this, I would have thought like maybe the CDC was its own thing in the cabinet, but it's one of the big agencies that's under Health and Human Services. Here's another real biggie that definitely affects the people we support. It's the Centers for Medicare and Medicaid Services. So all of Medicaid is under Health and Human Services. And the Center for Medicare and Medicaid Services deals with both. Then there's people within it that oversee each part. And I think we've talked about this before in this meeting, that the person who's over Medicaid services at the federal level is Drew Snyder, who used to be the head of Medicaid here in Mississippi. Okay. The FDA, you guys probably heard of that. That ensures that food is safe, pure, and wholesome. Here's a biggie. The Health Resources and Services Administration, and it's typically referred to just as HRSA. So let's look at what it does. Part of the public health service provides health care to people who are geographically isolated, economically and medically vulnerable. So a lot of the money that goes to state health departments to make sure people in rural areas, people who don't have a lot of money, get services, like have a place they can go to and get treated for a sexually transmitted disease or tested for it or get a shot. That's some of the very basic functions. Indian Health Service, National Institutes of Health. So does a lot of research. So you can see supports biomedical and behavioral research with the United States and abroad. Trains promising researchers, promotes collecting and sharing medical knowledge. So that's a biggie. Office for Civil Rights. I think this is true. I think every division of the cabinet has an office of civil rights to make sure within that division that people's civil rights are protected. Office of Inspector General is usually where you can turn in concerns, complaints. their lawyer. Here's a biggie for us. Substance Abuse and Mental Health Services Administration. A lot of times we hear that referred to as SAMHSA. So it too is part of public health services, improves access and reduces barriers to high quality, effective programs and services for individuals who suffer from or are at risk for addictive and mental disorders, as well as their families and communities. So support for mental health and support for substance use treatment. So that's a bunch of stuff all within HHS, and HHS again stands for Health and Human Services, and it's one part of that cabinet. Were there any surprises on there for anyone? All right, so one thing you've probably noticed since in the new presidential administration, that there has been a big emphasis, and this is in response to some of the executive orders, which is what the president, remember, he's the chief executive, ordered when he came in, for things to be as efficient as possible, to run as efficiently as possible, and to be as cost effective as possible. That has been a huge emphasis in this administration. So every head of one of these agencies in the cabinet, so all of these, has been charged with, what are your plans to make this all run as efficiently as possible? Now, I'm not saying that the plans they came up with are the right plans. Families as allies, we just want to get the information out to you. You think it through. Families have the information they need. If they think it's a good plan, they can, just not do anything, or they can, let someone know. I think that's great you did it that way. If they have concerns, we want people to have the information they need to know what's going on, and then who to contact if they have concerns. So every agency in the cabinet, every department head was given this task to make sure things are as efficient as possible. So this is what Health and Human Services did. They basically, let's just read the first paragraph. This was at the end of March. Today, the U.S. Department of Health and Human Services announced a dramatic restructuring in accordance with President Trump's executive order. So, he's the chief executive, that's the executive branch, and he gave this order implementing the president's Department of Government Efficiency, which you probably heard of, is DOGE, Workforce Optimization Initiative. And they tell us that this restructuring will address this and serve multiple goals without impacting critical services. So they are saying that they went through this, and the critical services, the services that people all really need, they will not be affected. And it's supposed to save taxpayers $1.8 billion a year. It reduced the workforce from 82,000 to 62,000. It streamlines the functions of the department. Now, and this is, I know it, we say at Families as Allies, we just give you the information. We're going to do a joy aside here. There does tend to be a lot of replication in government, including at the state level, like in back office stuff. And I think one thing that was looked at on this is like, when this first came out and I was listening to Secretary Kennedy, he was saying all these different agencies within HHS all have their own communications department. Do they need that? Or could one communications department help everybody with their website? Those types of things. So that's one thing they looked at, is streamlining the functions of the department. And then an emphasis in this administration is to prioritize ending the epidemic of chronic disease in the United States by focusing on safe, wholesome food, clean water, and the elimination of environmental toxins. So these are the specific ways they did that. They created a new agency called the Administration for a Healthy America, AHA, and that combines multiple agencies. The thing that's most relevant to what we do is HRSA is now under that agency, and it's pretty much like HRSA is going away. Instead of there being a HRSA, which is that Health Resources and Services Administration, and also the Substance Abuse and Mental Health Services Administration, SAMHSA. They are now part of that, but not like you put, from what I understand, not like we said, okay, we're just going to put SAMHSA here and it'll run the same way. It's more like we're folding SAMHSA and HRSA into this, and we're going to look at all of their programs and see which ones should continue and where they should be. And then you can see they combine some others, right? This centralization will improve coordination of health resources for low-income Americans and will focus on areas including, so they're going to focus in combining all these things, primary care, maternal and child health, mental health, environmental health, HIV, AIDS, and workforce development. Transferring SAMHSA to this organization will increase operational efficiency and assure programs are carried out because it will break down artificial divisions between similar programs. So that is what they're telling us they will do. Now, whether or not that happens, we don't know, but that's their goal. Let's see what else it says. Okay. We're glad you're here, Miss Butler, no matter whose computer you're on. Okay. And then it combines some offices. Now, there's been a lot of concern. We talked about this at the beginning, reorganization of the Administration for Community Living. And that's the agency that has focused on the rights and protecting the rights of elderly people and people with disabilities. And this says, this is their memo, this is the White House's memo. Critical programs that support older adults and people with disabilities will be integrated into other HHS agencies, including the Administration for Children and Families, ASPE, and the Centers for Medicaid and Medicare Services. So they're saying we're going to take some of those core functions and have them go through these other agencies. That's what they're saying. The reorganization will not impact Medicare and Medicaid services. That's what they're saying. So we need to make sure that those are the things that happen. But that's what they're saying. Over time, bureaucracies, and this is from Secretary Kennedy, like HHS, become wasteful and inefficient, even when most of their staff are dedicated and competent civil service servants. This overhaul will be a win-win for taxpayers and for those that HHS serves. So the Secretary of Health and Human Services, when they announced this, said this is going to be a win-win for taxpayers and also for the people these agencies serve, which would be a lot of the people we work with. And he says that's actually the entire American public because our goal is to make America healthy again. And then they also share this fact sheet that says this is what's going to happen. Any thoughts or questions about that? All right. And then this is something that we don't know yet, but going back to our chart, we know that the executive branch, one thing they do through their office of management and budget, if you ever hear anybody talk about, oh, there was an OMB memo, that's what they're talking about. Now remember, they don't make the laws. The president does not make the laws. The president carries out the laws that the legislative branch makes and does have some room through executive orders to say we're going to do this about this thing for now. But as you've seen, like President Trump came in and did executive orders, and this is common, that undid executive orders that President Biden did. So it's not, executive orders don't go on forever. But law is a law until it gets changed, like through the Supreme Court or ruled unconstitutional. Okay. All right. So the president has made these recommendations. And then this is some information. And all that stuff we were looking at before is like from the end of March, very beginning of April. This is within the last few days that there was, and one thing that happens is any of these branches, and it's usually most common in the executive branch, they'll sometimes leak things to the press. And a lot of times the press is called the fourth estate because one thing that Constitution says is that we have freedom of the press in this country. So the press can report on what's going on in the government. That helps hold the government accountable. That lets all of us as citizens know what's going on. Now, we don't know in any given article how accurate what they're reporting is, but that's the purpose of the press, is to hold all those branches accountable, to hold the government accountable. So there was a memo from the White House's Office of Management and Budget that got leaked. That means that it wasn't public, but somebody went to the press and said, this is what, here it is. Okay. About what the president's recommending. Now, keep in mind, while the leaked draft may undergo changes before emerging as the final 2026, and that's budget appropriation, I can't remember exactly what that stands for. It provides some early insight into what the administration might be thinking. Now, keep in mind, ultimately, it will be up to Congress to accept or reject funding levels or policy proposals. So if there are things in here that you have feedback or some family has feedback for, who you want to contact is your United States senators. And for us, that's Senator Cindy Hyde-Smith and Senator Roger Wicker. And then your United States representative, which we've shown you before, and we can do it again at the end, how to find them. Okay. So one of the first things is with the National Institutes of Health, and that's the one that does all the research, proposes a total program funding level that's cut a 42% decrease. And then it gives more detail of where that would come from. And you can see some of these things that, like where this Family Health Information Center, I don't think this doesn't necessarily have anything to do with Family Health Information Center, but families, who have a child with allergies, if it looks like it's being proposed to cut money specifically to the National Institute of Allergy and Infectious Diseases, heart, lung, kidney. So there's just some detail in here about very specific institutes and agencies that are recommended to have funding cuts related to specific diseases. More about research. Okay, let's look at Health Resources and Services Administration, HRSA. So the proposed budget would eliminate the majority of workforce programs at HRSA, including nearly all Title V health professions and Title V nursing workforce programs, so programs that help develop the workforce, and move other core programs to that new administration for Healthy America, for a Healthy America. That's that new agency we learned about. And they're saying we looked and the most important core functions are still going to be there. So they're telling us that core programs from Title V, which is the maternal child health, are still going to exist at this Healthy America agency. Then it shows you some things that are eliminated, that are proposed to be eliminated. One of those is the Behavioral Health Workforce Education and Training Program, which helps train behavioral health workers. We just put in a grant through that program that would have trained more parent-peer supporters. So if this gets cut, we'll find out, okay, they're not doing that grant. We may find that out even if it doesn't get cut, because that was a grant we worked really hard on, but it was hard to do. The proposed budget would also eliminate programs in the Ryan White HIV/AIDS program. It's not saying all of them, but including the Ryan White Special Projects of National Significance. Okay, let's look at that. So HRSA, looks like there's going to be some cuts, especially to workforce development. Substance Abuse and Mental Health Services Administration, SAMHSA. While mental health services and substance use treatment would receive substantial cuts of approximately 25 and 13%. So mental health services, this is what's currently proposed. But the legislative branch will be looking at this, is to cut mental health services. So that would mean the funding 25% and substance use treatment 13% each. Okay, then substance use prevention will be nearly eliminated with about a 92% cut. Now, I don't know what that means as far as one thing that goes through this is Narcan. I think it goes through here. Some of it goes through the CDC. I don't know how that would be affected. So there's some pretty significant cuts to SAMHSA. So then for this new agency, the Administration for a Healthy America, I think I was looking at the wrong thing. So that includes the consolidation of a number of agencies, including the National Institutes of Environmental Health, large components of HRSA, SAMHSA, and the CDC. So they're all going to get folded together. Preserved programs from HRSA that would be moved to AHA. So these are ones they're saying this will continue. Our Nurse Corps, Centers of Excellence, Workforce Assessment, and Pediatric Subspecialty Loan Repayment. Now, I don't know what that means about things like from the Title V block grant. I don't know what that means about family to family. And family to family is its own line item in the budget. So I don't know. Additionally, SAMHSA, Centers for Mental Health Services, Substance Use Treatment, and Substance Use Prevention would be maintained within the AHA. But they've also told us that mental health will be cut by 25%, substance use treatment will be cut by 13%, and prevention will be cut by, what was it? 92%. So I don't know if that means they'll exist the same way, but be cut by that much. But they're kind of telling us both things. They'll exist, but they'll be cut. And then the Administration for Children and Families that we talked about, that's a lot of think I've got that right, Child Welfare and Administration for Community Living. That's the one that deals with people with disabilities and older people. So these are some things they're proposing to eliminate: the National Institute on Disability, Independent Living, and Rehabilitation Research, and the University Centers of Excellence in Developmental Disabilities Program. So that Institute of Disability Studies, IDS, that you may have heard about, that's at Southern, that's a center of excellence in developmental disabilities. That's a place where it's like they should be doing the best research to find out what's really going to help people with developmental disabilities. So things like that would go away. In, and so those would be eliminated. Instead, ACF would receive an additional $325 million for independent living state grants, providing states with flexibility to support disability and independent living focused projects with grant and formula funding. So they're going to take that money and basically block grant it to the states and say, what do you think needs to happen? And within this, and I guess this is under ACF, I didn't even think about it. This pass back that they're proposing, what they're proposing to do, would also, they're proposing to eliminate the Head Start program. So that's a huge one. This one, mostly capping independent costs, mostly affects universities that get government funding. Okay. So those are some things that have been leaked to the press. Okay. Thoughts, questions?
Eliminating Head Start is just such a just disheartening. I really hate to hear that.
Yeah, it's discouraging. Now, you can think about, do I have options? So, and I know we talk about this in every meeting. You can go to open states, find your legislator, and it's actually plural policy now, but y'all know every time I never remember that. And you can go find your legislators, put in my work address, search by address. And right now, this will give me my state legislators. And a lot of the times during the session, we're looking at, during the Mississippi legislative session, we're looking at our state legislators. Right now, this is federal. So if you have concerns about this, the people you want to call or contact, or if a family has concerns, are their legislators at the United States level. So again, all of us every state has 2 senators, no matter how big it is. And all of us in Mississippi have the same 2 senators, Senator Cindy Hyde-Smith and Senator Roger Wicker. So you can click on Senator Smith's, the link on her, and you can see all her capital offices, and you can look and say, which one's closest to me? And I'm going to call that one. Or you can call up at the United States Capitol. You can email and just say, and you don't have to know everything, but you can say, I know there's going to be some cuts. These are services, like let's just say you have a child with a developmental disability. It does sound like there's some pretty significant things that are going to be cut. Just saying it's really important. These kinds of services help me and my child. We do not want this cut. This is how Medicaid helps us. This is how all of those services within Health and Human Services. And then the one place where this gets tricky, all of us have the same 2 senators. Oops, I'm making this get too big. But we do not all have the same representatives. So, or congressmen. So I put in my work address, and Senator Thompson, Benny Thompson, is my congressman, my representative. So then these are all the places I can contact him. If I would have put in my home address, and we've done that before in these meetings, you all know, because we've done it so many times. Michael Guess is my representative, my congressman. So that person differs, but you want to call them too and say, I know you all are going to be working on this budget. These are some things that are really important for me and my family. Now, this is also probably going to affect us at the state level, like that money that we heard about that they're going to say, and we're not going to spend this at the federal level. We're going to turn around and give it to the states, like the money that's currently going for those centers of excellence on university campuses, like Institute for Disability Studies. If that gets cut, and if they do turn around and reallocate some of that money directly to the states, and we don't know if that's going to happen, but let's just say that happens, then that's when we'd want to be calling our state people and saying, this is how I think that money needs to be spent once it gets back to the state. And we need people with developmental disabilities, we need their families at the table helping decide. Okay. All right. Now, another thing that happened, and we did a blog about this. Am I still sharing? Did I remember to share? Did I share the open states thing?
No, it's cut off
Oh, I
a
am
while
so
back.
sorry, you guys. Y'all need to tell me when I'm messing up. Okay, let's go back to that. All right, let's go to, it's actually plural policy. Please tell me when if ever I mess on sharing. Plural policy. Oh, actually, this is. Actually, we're going to go back to open states. Go to open states. Find your legislator. Put in your address. And who you want to. You don't want to go to for this that we talked about today. It's federal, it's not state. So then you can come down here. We all have the same two senators, Cindy Hyde Smith. Click. You can call her district office that's nearest you, or you can call Washington, D.C., and you'll talk to an aide, but that's fine. Then Roger Wicker, call him too, because we all have the same two senators, and they need to keep hearing from us and keep hearing from us and keep hearing from us because they have a lot of things to decide right now. And they need to hear from everyone. And what you think may be different than what I think. We may think the total opposite things. You might think, oh, I don't like this at all, what's happening. Maybe I think, oh, for my child, this is good. We don't know. But they need to hear from everyone. We're not trying to get you to say a certain thing. We're trying to get you to share, encouraging you to share what's important to your family. We all have different representatives depending on where we live. There's 4. So I put in my work address for that. It's Benny Thompson, Congressman Benny Thompson. So I can contact him through one of these. Okay, so that's that. And then while we're on here, another thing that happened last week is Secretary Kennedy gave a press conference on a report about autism. And a lot of his remarks got a lot of attention. And there were many different viewpoints on them. So what we're encouraging everyone to do is to go back and look at the report. It's a scientific report, so it's a little bit heavy, but it's there and you can look at it. And then we encourage you to listen to his remarks in their entirety, to listen to everything he said and think about this report, which came out from the Centers for Disease Control, and then his remarks on the report, and you can give your feedback on what you think. And we have seen a wide range of responses to this. And it doesn't matter what we think about people's responses. In fact, we are there to support families, to advocate with them. So what their perspective is to make sure everybody feels comfortable sharing it. Opportunity you have there. I know a lot of people are sharing their perspectives on social media, and there's certainly lots of different ways to share. One thing that we noticed is in his remarks, he never said that on autism, that Secretary Kennedy never said that there were people with autism, or because he's saying they're going to now look at what needs to be done to address autism and to develop a report. And it's a really quick turnaround time, like by September. He never mentioned people with autism or their families being involved in that process. And that is one thing we do have an opinion on, or a stance, and that's, families should always be at the table. So if you would like to contact him, either about his remarks about autism or his just all the stuff that's happening with HHS, here is his bio page, and it's linked in that blog we did. Now, last week, emailing him didn't work. This link wouldn't work. It doesn't look like it's working this week either. Last week, though, when we went to Facebook, it did work. So you can go to Facebook, if you're on Facebook, and just say, Secretary Kennedy, I listened to your remarks. This is what I think. Oh wait, it's actually not letting me. Let's see. Oh, that's just letting me share it. Hang on just a second. They may have turned off that feature. Oh wait, okay, maybe I'm clicking on the wrong thing. That's it. So you can go, make sure you go, and probably all y'all know that, to the ones that are right by his name. So comments are enabled on here. See, there was one. So he's got this post from April 17th. President Trump has tasked me with identifying root causes of childhood chronic disease epidemic, including autism. So that would be one place where you could comment. Yeah, and comments are still enabled. So that's one way to give feedback on that. And then, and I know we talked about two ways, to support families. One is to just let them know that these are ways they can share their feedback. And also, we really want to encourage everyone to recognize, particularly on these autism remarks, that there seems to be a really wide range of different ways that the families we support are, they feel about this and they're responding. We do not want any family to feel they have to respond a certain way or think a certain thing. And in our supporting of them, to convey that at all. So we would hope and want to, for all of you who are out there supporting families, we would encourage you to take the same stance. So, and I apologize again for forgetting to share a few times. Any thoughts, comments? And please let me know in the chat if anybody feels like they don't want this shared. Okay, well, I appreciate everyone being here. And let me know. Also, any thoughts on how helpful this is and anything we can do to make this more helpful? Besides me remembering to share my screen when I think I am. Oh, thank you.
I think you did a good job of walking through all of the steps, Joy.
You know me and all that dry policy stuff, Nikki. I just thrive on it.
Yeah, but you
I don't
explain it in
necessarily.
a way that it makes sense. It makes you can follow it.
Well, good. If I'm ever not, y'all tell me, and y'all tell me when I'm forgetting to share my screen because everybody knows I'm a space cadet. And I should have worn lip gloss for y'all. Just noticed I look faded. Well, I appreciate you guys so much. And you know how we end all our meetings at Families as Allies. Y'all go forth and conquer. Thank you for being here. And remember, when we're all standing together, there is nothing we can't get done for our children. We have a lot of stuff going on right now. We got to stand together and we got to go forth and conquer and help everybody stand together. Even if we feel very differently, we're still all families here for our children. Okay. All right. Thanks, y'all. Bye.